Now we are going to have Dr. Brendan. Dr. Brendan is someone who has been working in the field for 22 years. And as Dr. Mukami said, veterinary, being a vet doctor, it's mastering the art. So we can say he has been mastering the art for 22 years. And he has immobilized more big cats than most of us have seen in the documentaries. So we should expect stories like some tales from him, like you won't believe these surgery stories kind of, because he has met most of these situations in the field. So ladies and gentlemen, help me welcome Dr. Brendan on the stage.
Good. There we go. Thank you, Sela. Yeah, welcome everyone, and yeah, it's a privilege for me to be able to address you all today and give you just an insight into just some of the experience I have, and just I think to give a 45-minute talk on wild felid immobilization, one has to condense it quite a bit. There's a lot of experience that does come in, as she mentioned. I guess the aim is that after 25 years of working with big cats, if you can still count all 10 fingers, then you've been able to avoid most of the dangerous stuff. So I'm quite happy to be able to tell you that I still have 10 fingers and 10 toes. So that's a good thing, I guess. Yeah. So essentially what I'd like to do today is I'm going to just give a brief summary of my protocols and with regards to immobilization of big cats. This was specifically put together for wild felids, okay, but it's very similar for captive felids as well, for captive lions and some of the other big carnivores. I think there's just a couple of extra things that need to be taken into consideration when working out in the field, especially when one is working from a helicopter, etc. That adds a little bit of additional administration and experience when it comes to that. But I think we can extrapolate a lot of the stuff from today to captive carnivores as well, and can take it from there. What I'm going to do then, I'm going to just share my screen now quickly, and let's get straight on with the presentation. Perhaps just a little bit more information just about myself. Yes, I'm a veterinarian. I have just over 25 years experience working as a wildlife veterinarian. I also have a domestic practice as well. I don't spend much time in the domestic practice. I have quite a keen interest in equine work as well. So I do a lot of horse work, and I do quite a lot of horse breeding work as well. But the majority of my focus over the years has been certainly in the wildlife field. I've worked in both the private sector and in the public sector. Spent many years working as a wildlife veterinarian in Namibia for the Ministry of Environment and Tourism there, heading up their veterinary section of and running their major game capture unit there. And then I came back to South Africa, and for the past probably 16 years or so in South Africa, I have been involved in conservation projects, pretty much throughout Africa, but majority of the stuff in South Africa, although I've traveled extensively outside of Africa, even to your country as well. Back in 2003, I spent quite a bit of time with an operation restocking Majeti Game Reserve, the very first operation that took place there, where we captured a lot of animals from Lengwe and from Lilongwe, sorry, I've forgotten what the name of that big reserve is up on the river up there. But yeah, we spent a couple of months there in Malawi doing quite a bit of relocation work and stuff there, but mostly buffalo and other antelope species. So yeah, I've got a wealth of knowledge in both a captive environment, but most of my work and my passion revolves around conservation projects, in particular rhino and also big cat conservation as well. Okay, so without further ado, I'm going to go and share my screen and just pull up the PowerPoint for you guys there, and then we can head straight into it. So as I said, this presentation was really focused on free-ranging large felids and the veterinary challenge there, and how us as veterinarians get involved and the role we play, and then obviously just a little bit more in-depth information regarding what protocols can we use, what are the things we need to look out for, how do we mitigate against some of the problems, etc., and what are some of the challenges that we face. Yeah, so it's pretty generalized. Obviously, one has to bear in mind that there's a lot of variation between species. Cheetah obviously being some of the more sensitive felines that we deal with. We obviously take extra special precautions with regards to cheetah in particular. I think it's a sad fact that a lot of cheetah die under the hands of veterinarians, often because of incorrect protocols and incorrect management of animals that have been immobilized, but they are particularly sensitive. So we have extra care with cheetah, and obviously then when we start to deal with some of the bigger felines like lions, obviously we need to be a little bit more cautious with regards to how we manage them with regards to the safety of people involved around them as well. So there are differences, but I think in general we can manage most of them in a very similar manner. All right, and if we have a look at the role of a veterinarian in large carnivore conservation, it really boils down to, and we've seen over the years, that expertise is crucial to, veterinary expertise is crucial to carnivore conservation. There are a number of us that play an active role in advising and assisting with the metapopulation management. I think if we look at globally, but in Africa in particular, a lot of our big conservation areas have become very fragmented. So we've got areas that are segregated from each other, that historically may have allowed free movement of carnivores and other wildlife species to move freely between them, but they've been broken up by loss of habitat due to farming practices, etc., and the erection of fences. And so those natural migration patterns don't happen anymore. And as a result of that, we need to manage these populations that are isolated very carefully. I see a little bit earlier on the chat group, someone mentioned about managing genetics, and I think that's a very important point, and that's where veterinarians come into play there with managing those situations. We do need to constantly be vigilant with regards to how do we manage genetic flow between populations, and that's where we take on a metapopulation management approach, and we select individuals to rotate between populations so that we can increase the genetic diversity that exists in those populations. It obviously allows for increased genetic stability and increased genetic vigor in those populations, and that's very crucial. That we constantly aware of that, and veterinarians are the best people equipped to work together with other role players. I think that we must understand that a lot of this work involves a team approach, with the veterinarian just being one member in that team, a very crucial member, but yet we're still one member, and we need to be able to work very closely together with other professionals, conservationists in particular, geneticists, etc. So it really is a team approach, but the veterinarian plays a crucial and integral, pivotal role in that whole process. And when it comes down to the basics, every time we move one of these carnivores, it requires them to be immobilized, and so immobilization becomes the crux of the matter. And if we can't manage immobilization safely, then ultimately our whole exercise becomes flawed. And so understanding the risks of immobilization and how we manage these animals, many of them we're dealing with, in particular, a species again like cheetah, which has a very small and limited population. Every individual becomes valuable, and every animal that we lose is vital, and can play a significant role in the success of these projects. So safe immobilization obviously is paramount and key to the success of everything. So what are the challenges that we might find in particular with wild felid immobilization? They often exist, these animals, in big free-ranging environments. They very often cannot be approached from the ground, and yeah, unlike working in captive and rehabilitation centers, we often have to use a helicopter to immobilize these animals, and that obviously leads to many other high-risk factors that need to be considered. These cats at the sight of a helicopter, are stressed beyond their normal responses. They go into a flight mode. It increases their adrenaline levels, and then that makes immobilization just that much more difficult. And these are things that we need to be aware of, and we need to try and mitigate against some of these negative and challenging factors that potentially present a risk, to the health of the animal as a result of our intervention. Yeah, just a couple of pictures of just some rare occasions and interesting ones. The animal on the left is a big male white lion that needed to be transported. It was a long distance transportation this particular animal was one of those animals that was rescued out of a breeding facility that was destined probably to form either part of a canned hunting, illegal trophy hunting protocol or operation, or ultimately ending up in the bone trade market. This was a white lion, and it was purchased and rescued out of a particular facility, but it needed to be. It could never be released completely wild, but we had a really wonderful facility where it could be released together with some other females, and to live a semi-free type of life. It was controlled, but they were able to hunt on their own, etc., which was actually a wonderful outcome. But it did require a 4.5-hour flight. And so this was quite a long period of time for me to keep this big lion immobilized. And it's obviously, as you can see, it can be quite a stressful procedure. We've got this animal that's filling up the whole of the aeroplane. Clearly, if this lion wakes up in this environment, I think it would end up in a disastrous situation. So one has to be able to be confident to keep this animal asleep. And yeah, everything in this case obviously went well, but it's nonetheless still a very stressful operation, both for the veterinarian and the team involved, but then also for the lion to be able to keep that animal under anesthetic for, I think at the end of the day with this lion, it was probably close on about 4 or 5 hours that it was needed to be kept asleep. But it was successful at the end of the day. The picture on the right is it's actually a video. I'm going to play it for you, but this was a cheetah that escaped out of a reserve down in the southern part of South Africa, very remote area, and disappeared out of a reserve, ended up in the mountains, and the only way to recover it in the mountains, there's no roads or anything like that. We were able to locate it with a helicopter, immobilize it with a helicopter, out of the helicopter, and then ultimately transport it back to the reserve out of the mountains, asleep in the helicopter. And I think I can just play that for you there now. Yeah, this is just an example of the terrain we're working in, right up in the mountains. And again, this is a good example of teamwork. Here we have to have a very competent helicopter pilot, and then the conservation officer also there, who was aware of where the location roughly was. But you can see us having to fly this animal out of these mountains, asleep in an open helicopter. Again, if this animal is not immobilized properly, this type of operation can't take place safely for both the animal and obviously for the occupants of the helicopter as well. So just a little example of how challenging these situations can become at times. All right. If we now move on to some of the risk factors when we need to take into consideration when we immobilizing these big cats in these environments. the first thing we need to look at is, what are the environmental conditions? I think that's vitally important. We can't just go out straight away and just expect that the temperature and the environment is going to be conducive every time to a safe immobilization. Temperatures are often particularly high, and other times they can be really, really low. That cheetah, for instance, was immobilized initially under very low temperature conditions high up in the mountains where often we pick up snow, etc. And so we need to make sure that we prevent both hypothermia and hypothermia. And so if the temperature and environmental conditions are not conducive to it, and if it's possible that we can delay these operations, then it's best to make that call right early on before you run into trouble. Unfortunately, sometimes that's not the case. Because of emergency situations, we need to operate in temperatures that are not ideal, but then we need to mitigate against those. If it's hot, we can apply water, we can use intravenous fluid that is chilled, that helps to cool down core body temperature. If the temperature is really low, then hot water bottles, etc., anything, blankets, anything that can keep core body temperature up is going to make a big difference as well. So we can mitigate against them to a certain extent. It can be challenging darting. I mean, you can imagine trying to dart a cheetah up in those mountains. Not only is the helicopter straining because of altitude, it's not flying as well as it would, for instance, at sea level. That makes it difficult for the chopper pilot. But for us darting in the back there as well, the cheetah, is moving relatively quickly. So, darting out of a helicopter, especially with a small target and that's moving pretty fast like a cheetah, can be quite challenging. So that's something one would like to use an experienced person to do that type of work that's got experience darting out of a helicopter, so that you don't chase those animals unnecessarily for long periods of time, because we're going to pick up problems. The longer we chase them, the higher their body temperatures become, the more we upset their metabolic status, and the higher the risks of complications associated with that. These animals that are, I've already alluded to this, that we do dart out of a helicopter, often experience high levels of physical exertion, and that creates, increases in lactic acid, increases in body temperature, and these can all lead to, side effects that in particular can be very detrimental to the animal. These animals can become completely exhausted if they chased unnecessarily long. Okay, I've mentioned hypothermia, and then then renal compromise is a particularly important one. We see this in particular with regards to cheetah immobilization. They have inherently sort of poor renal function anyway, and then with immobilization we tend to get a drop in blood pressure, and with that drop in blood pressure we get reduced renal perfusion, and if that is prolonged, then this ultimately leads to renal damage, which is very often irreversible. On the right-hand side, those serum chemistry values there are from a cheetah that was a extremely old cheetah that I immobilized. It's just an example to give you an indication of how sensitive those kidneys become. This cheetah was a captive cheetah. It was extremely old cheetah, and but when we look at those blood results, we can see that the values that are particularly important for us are the urea and the creatinine values. In this case, the creatinine values were extremely high, as well as the urea levels. Okay, and then we're fortunate now as well to be able to run SDMA tests on these animals, which is a much more sensitive test for the prediction of renal failure and renal function. And then obviously, once we start to get to the end stage of renal failure, we start to see these massive increases in phosphate levels. And I mean, this cheetah in particular, it's not a cheetah that was particularly stressed or anything. So this is not a result of a stressful capture, but this is the type of picture we can end up with if we don't mitigate against preventing some form of renal damage or compromise during an immobilization process. It's quite possible to see these results in a young cheetah that underwent a very poor and stressful immobilization, and it wasn't treated appropriately for that. We end up with examples like this. And when we see a case like this, unfortunately, the prognosis is extremely poor. We don't easily get these animals to reverse from such advanced renal failure like this. So I think, in particular with cheetah, this is something that needs to be taken into consideration. Some of the other big cats, like lions, are much more robust. We don't seem to see the same deterioration, but in theory, it's quite possible that this can happen as well. So, just in principle, it's a good thing just to mitigate against this, and we can discuss that as it goes on just now. And then obviously drug intolerances as well. Not, every animal is an individual, and each animal potentially can have certain adverse reactions to drugs. We do see, again, cheetah, the poor old cheetah. It seems to be the weak one in the whole large feline family. They seem to suffer from everything. So some of the drug intolerances that we see can happen in cheetah in particular, but other ones would be species that aren't really endemic to Africa, but tigers in particular. If you are working in a zoo environment, tigers can be quite sensitive to some of the drugs, in particular tilazol or xylitol, and one just has to be aware of these things and anticipate that you may see adverse reactions and then be able to respond appropriately if one does see those adverse reactions. Okay, and so now when we start to look at our considerations with regards to the pharmacology and selecting drugs that we want to use, we can obviously put together a list of the ideal characteristics of an immobilizing drug. And I can run through those quickly, but I think what we have to understand is that, unfortunately, it's almost impossible to try and cater for every single one of those characteristics to make the drug as safe as possible. There are always going to be risks, but as long as we are aware of them, then we can do something about it. And if we're aware of what we're looking for, then we can also select the drugs that most ideally fit what the characteristics or the needs of what we are trying to achieve. And if we can use alternative combinations that make them safer under certain circumstances, then we need to be aware of that and need to be able to implement that and make those correct decisions. Okay, so because if you can see me loading a dart on the left-hand side there, that is a dart that has a capacity of 1 cc, okay, 1 milliliter, very small capacity. It's a big advantage for us to be able to dart with a small dart. It's less trauma on the animal. It's much more stable in the air. And so we try and use the smallest dart possible to try and reduce trauma and make our job a whole lot easier. But that does mean that we need to be able to fit all of our drugs that we want to immobilize, for instance, a large male lion, into a 1 or a 2 cc dart. So that can become challenging, and which means that the drugs need to be highly potent so that we can reach those levels in order to reduce the volume required. Ideally, we would like a wide safety margin. I think in carnivores in particular, in general, the drugs we use do have a fairly wide safety margin. So we're fortunate there. Some of the other species that we have to immobilize, our safety margin decreases substantially. But for felids, we generally have fairly wide safety margins when we are working with them. Again, rapid onset of action. I think when we're darting out of a helicopter, that becomes even more important. We don't want these animals running for excessive amounts of time. We need a rapid onset of action. They need to become immobilized within reason in the shortest time possible. And in general, we would like an induction time of about 5 minutes, 5 to 6 minutes. In a captive environment, there's a little bit more leeway. We'll often reduce our doses substantially in captive environments because we have time in our hands. And so we can immobilize an animal and give them 10 or 15 minutes to become completely immobilized. But when we're working out in the field, We need to reduce the time that they're running. We also have to be aware that, the longer they run, the more chance we have of losing sight of them. So rapid onset of action is very important when considering drug combinations. Okay, and making the combination reversible is desirable. Historically, a lot of our combinations weren't reversible, but nowadays with new drugs and with the ability to concentrate our drugs, then we're able to utilize combinations of drugs that do make our combinations reversible. So that's very, very desirable. We talk about experiences in life. Sela mentioned, yeah, do we have stories? Well, I think back in my early career, the number of times that I would need to wait around for 5 or 6 hours while a pride of lions that I'd immobilized recovered from anesthetic that was not reversible, because that was what was available to us in those days, and the difficulties associated with that when other lions come into the area, or in particular elephants come in there. Elephants don't tolerate sleeping lions particularly well, and I've had some nightmare nights out there driving my pickup, Land Cruiser, trying to chase elephants away from a pride of lions that was sleeping very comfortably under the tree, completely unaware of the risk they were at or facing due to a herd of elephants approaching. So one does have those hairy moments, and if we can make the combinations reversible, at least we get them back up on their feet and compos mentis as soon as possible. So that's very beneficial. We want those drugs to be eliminated from the body as quickly as possible. As those are some things that we just can't always mitigate against. I mean, some of the drugs, it is what it is. And then, side effects. We want to select drugs that have the least side effects, and that falls into the same category as B up there, the wide safety margin. So, we want combinations that potentially produce minimal side effects. Induction, obviously important. Induction and recovery, if they can be calm, we have a much better chance of a successful immobilization and a successful recovery if they're not stressed when they ultimately become induced or when they recover. It's nice to see that. And then we also have to take into consideration not only the people handling the drugs, but also potentially the people around, and that we take into consideration human aspects of safety as well. So as the veterinarian, our responsibility is not only the responsibility of a safe immobilization and our patient, but we also have to be responsible for the people that are assisting us. These operations always gather a number of people, and it is the leader of the operation, which is inevitably the veterinarian. It's their responsibility to oversee everything and make sure that not only is the patient safe, but the people that are working with the patient are also kept as safe as possible. All right, if we start looking at some of the anesthetic combinations, then a little bit more into the details here. We're fortunate that we do have a variety of combinations available to us. And what you'll notice is that it's seldom that we use a single drug on its own. In general, we refer to our combinations as cocktails, and we end up, with a cocktail of drugs that we would utilize. And the benefits of using a cocktail are that the synergistic effect between the drugs that we select often allows us to reduce the doses of the individual drugs, and obviously that makes the safety margin so much higher. If we can reduce doses but get the same effects, that makes the combination a little bit more suitable and ideal for what we're wanting to do. The first combination there is just is xolitol on its own. The xolitol, although we see it probably as a standalone drug, it is already reconstituted as a combination of tyletamine and zolazepam, and it is the drug historically that we used to use the most, probably in the early 2000s, where we didn't have other drugs available to us. And so xolitol was, extremely effective. It gave a great anesthetic, but it was not reversible. And so these animals took exorbitantly long time to recover, which created the problems that I described a little earlier. Then some of the more modern, combinations: ketamine, medetomidine. Ketamine everyone is aware of, and medetomidine everyone is aware of as well. Historically, we weren't able to use these combinations because medetomidine was only supplied in its generic form, or in its original form, as Domitor, which was a 1 milligram per mil solution, which really is not concentrated enough to allow us to use relatively small volumes. If we had included medetomidine in those days, we would have needed a dart size somewhere in the region of about 10 cc's, which is just way too big and impractical to start using in the field for immobilization. The darts don't fly well, creates a lot of trauma to the animals. It's kind of like paramount to shooting a missile out at these poor animals. And so it really wasn't practical to do that. But nowadays, through our compounding pharmacies, we're able to get medetomidine manufactured for us at much higher concentrations. So my typical concentration that I use is 20 times the strength of normal Domitor, which is 20 milligrams per mil. And that allows me to be able to, for a adult line immobilization, almost get away with being able to use 1 cc of combined drug volume, which is amazing, and we get a really, really good anesthetic as a result of that. So that's really promising, and it's made a huge difference to our lives as well. And the inclusion of medetomidine obviously also makes it reversible as well, because we can reverse the medetomidine. The ketamine, for all intents purposes, remains irreversible. There is a drug, flumazenil, which can be used to reverse ketamine. It's not readily available. It's extremely expensive. So I can't name one wildlife veterinarian that will have flumazenil, in their drug box. It's just not a practical drug to have. But by reducing the volume or the dose of ketamine that we require, if we can reverse the medetomidine, essentially we make that combination reversible, which is ideal for us. The next one is xolitol, medetomidine, same principle there. The xolitol just having the tiletamine and the zolazepam in it. Then together with medetomidine, we can reduce that dose of xolitol by about 20% of what we would have had to have used it on its own. And then when we take out, if we reverse the medetomidine there, that small amount of xolitol that we have used is not sufficient to keep the animal immobilized on its own, and then the animal does wake up. The nice thing about the adding the xolitol as opposed to the ketamine, the xolitol just increases the length or the duration of anesthesia, which I think under most wild or free range environments is beneficial. So that's a really nice combination of drugs to have. And as you'll see, it's probably my choice number one for immobilizing the big cats. And then the last one there I mentioned for completeness sake, there's quite a lot of literature out on the use of butorphanol and medetomidine and midazolam for immobilizing large carnivores. I haven't used it a lot because the experience I've had with it is that I don't get the same level and quality of immobilization. Unfortunately, there's some areas around the world and in Africa where just some of the other drugs aren't available, and we resort to other combinations using drugs that we can freely get and that are more freely available. And under those circumstances, potentially butorphanol, medetomidine, midazolam could be something that may need to be considered as a combination, but certainly it's not my go-to. I think that there are risks associated with it that are higher than the risks of the other combinations. But it is there for completeness sake because many veterinarians may need to resort back to that. Okay, if we look at xolitol just on its own, we'll briefly go through this. Xolitol on its own obviously has a very high safety margin. I think the most important thing when we're looking at these drugs, the dissociative anesthetics like tiletamine and ketamine, they cataleptoid drugs. Okay, so they have a tendency to cause a state of catalepsy, which ultimately can result in convulsions. Okay, this combination mitigates against that on its own because of the introduction of zolazepam in there The zolazepam, being one of the benzodiazepams, prevents these convulsions, and so it makes this combination of drugs, xylitol and or the zolazepam and tarletamine, a very safe option to go for, and just a very a great drug to have, and it's been improved tremendously now by us being able to use it in other combinations. But on its own, in field conditions, much higher doses are required of it. And in certain species, I did mention tigers, we can get quite adverse reactions to xylitol, which we have to be aware of. So we have to be careful of immobilizing those cats with extremely high doses of this drug. Okay, it takes a long time for them to recover from the anesthetic. It's not reversible. And then lastly, on its own, it's obviously quite an expensive option as well. The drug is very expensive, and if you're using it at those very high dose levels, it's going to make your anesthetic an expensive anesthesia. Okay, then ketamine, medetomidine, also has good safety margins. It's a very cost-effective drug combination. Ketamine is very, very, very cheap, certainly for us here in South Africa. And medetomidine is extremely cheap for us when we compound it. So this makes it a very cost-effective combination. Okay, if we're going to be using this combination in the field, we generally have to push the doses up quite high. The ketamine doesn't have that same level of anesthetic induction that we find with xylitol, and so we start pushing the ketamine dose up quite high. And if the animal is highly stressed, their adrenaline levels are able to suppress the effect of the ketamine and the medetomidine to a certain extent. And so these animals sometimes struggle to fall under anesthesia, to become immobilized, and that can present us with problems as well. And once we start to push up the level of ketamine as well, obviously increases our risks for convulsions. In this combination, we have nothing that mitigates, other than the medetomidine, nothing that mitigates against convulsions developing. So our real risks come in if we look at the reversibility of this, and we reverse these animals at an early stage in the anesthetic, which sometimes is necessary, and we want to do a very short anesthetic. Then reversing the medetomidine, if we've got a very high level of ketamine there, we do then risk these animals suddenly starting to get into a cataleptoid state and may experience convulsions, which can be quite stressful and obviously very dangerous for the animal. And then because they don't become immobilized as quickly in the field, the increased risks of exhaustion and hypothermia start to play a role. And anyway, as I said as well, the combination is reversible, which certainly does make it a nice combination. My tendency with these combinations is if I'm looking more at a captive environment and I'm looking at relatively short or non-invasive procedures, the ketamine medetomidine is a really nice combination to use. We can use relatively low doses, and if it takes about 10 or 15 minutes for the animal to become immobilized, it's not a crisis at all. We can just give them that time, and I think it's a nice safe combination to use under those circumstances. But I tend to avoid this combination if I'm working out in the field, and in particular if I'm darting from a helicopter, I wouldn't resort to this. Then, under those circumstances, I would resort to this. This is my favorite combination for working in the field: medetomidine and xylitol. Got really good safety margins by reducing the volume of and concentration or dose of xylitol that's required. We can reduce the cost substantially. We get really, really good effective induction at relatively short intervals in the field. The combination with the zolazepam and the medetomidine being present, we have very low risks of convulsions. Okay, and then because we get nice quick induction, risks for hypothermia and exhaustion are also reduced substantially. And then once we reverse the medetomidine, the effect of the zolazepam there really makes this a nice smooth recovery, and these animals wake up nice and relatively quickly but very calmly. So a very nice combination of drugs to have. And then the last one I spoke about was the butorphanol, medetomidine, midazolam. It's a much narrower safety margin. I think we get much greater cardiorespiratory suppressive effects using this combination. In the field, these animals take a longer time to go down, to become immobilized, and that increases our risks for hypothermia and exhaustion. Because we don't have any of the dissociative anesthetics, the ketamine or tyletamine in this combination, we have very low risk for convulsions, which is nice. In general, the recovery from this combination is very smooth. And generally, these drugs are also quite cost effective. So it's not a very expensive immobilization. So under certain circumstances, I think it's something to consider. But if I have alternatives, I'll rather resort to using those alternatives. I think again, it really boils down to the amount of experience you have using these combinations. Just purely because I do have alternatives. It's not a combination I resort to very often, and so probably I don't use it as frequently as potentially some other people may. I think once you experience with a combination, one learns how to handle it and what to expect. So under those circumstances, perhaps it is suitable, but for me, it's just not my first go-to combination. Okay, so what are my protocols for immobilizing wild felids? First of all, as I mentioned in the beginning, suitable environmental conditions. I don't want to be working when it's too cold, too hot, if possible, and so that's really something that I need to take into consideration. The correct choice of drug for that particular occasion is critical. So my first go-to, as I said, in the wild felids is the medetomidine xylitol combination. There you've got the doses that I use approximately. You can see the effect, the synergistic effect of the two together is really good. We've got relatively low doses of each one of those that give us a really, really good profound anesthetic. So that's really what I'm looking for after. Once I've got the animal immobilized, my first thing is to protect the eyes. One must remember that they lose their palpable reflex. And so these animals can't blink. These big cats, they don't blink anymore. So if you don't protect the eyes, so I will put eye treatment in. I just use a long-acting tear gel ointment, eye ointment, to lubricate the eye. And then I make sure that I protect the eye from sunlight, and so I put a blindfold on. But I think the blindfold is very important from a point of view of managing these animals and reducing external stimuli. One of the risks that we face and one of the challenges that we face is that very often these animals do become immobilized, but we struggle to handle them because they're not deep enough. We're able to approach them very safely, and we're able to gently drape a blindfold over the eyes, okay? And reducing that visual stimulus often allows us then to be able to work on the back of the animal. And so under these circumstances, when I get to a cat in particular, say for instance a big lion, where I get there and I can see that any form of stimulation is going to perhaps arouse this animal a little bit, I'll put a blindfold over the eyes very gently. I don't even need to tie it on. I might just drape that blindfold over the eyes just so that it can't see. And then just that on its own will allow me the opportunity to work on the back leg. And they've got a really, really, nice big vein on the medial side of the back leg, okay, the medial saphenous vein. And that allows us then to administer additional anesthetics intravenously. And under those circumstances, generally what I would do is top these animals up with a dose directly intravenously of medetomidine. Okay, medetomidine works exceptionally well as a top-up intravenously. I wouldn't consider using xylitol or ketamine in this. I think one then increases the risk of the cardiorespiratory effect, suppressive effect quite a lot. I think just on its own, medetomidine is often all that's necessary to just to give that additional anesthetic dose that's required to immobilize them completely. So that works really well. Other options are alfaxan, which is alfaxalone. That can also be used. It's a really, really safe drug to use. We cannot use it in the immobilizing cocktail, but as a maintenance of anesthesia, or just that small dose of top-up anesthesia that's required because of its wide safety margins, it's often a nice drug to use just at very low doses. I did put the doses in a little bit later of that. That can be used just intravenously, just to get that animal to sleep properly, that we can then put a proper blindfold on, and then we can work with the animal safely. And then one of the most important things for me is the establishment of an intravenous line. I might not use it in every single case, but certainly in cheetahs. Here's a cheetah that's been immobilized. This is a colleague of mine that I'm just taking the photos here, but we work together. He's one of the leading experts, probably the leading expert in large carnivore veterinary conservation. Dr. Peter Caldwell, really good friend of mine. We do a lot of work together. This was a group of wild cheetah that we immobilized together. And here you can see him just setting up an intravenous line. I think when we immobilize cheetah, I don't even think it's negotiable that we don't put cheetahs onto intravenous fluids. We just use a Ringer's lactate. I think all cheetahs benefit regardless of how long we immobilize them from. They're the most susceptible to renal failure as a result of reduced renal perfusion during anesthesia. So they all benefit from intravenous administration. We can put a nice big 18 gauge catheter into that medial saphenous vein. It's nice and easy to access. It's out of the way of anything that's happening in the front, and we can get a good flow rate. The important thing here is the flow rate. Again, here I think one can be tend to be a little conservative. I see that in some of my colleagues. They want to run the fluids in nice and slowly. In these circumstances, we put the first liter of Ringers in at full rate. We can get that in 15-20 minutes. For an adult cheetah, accommodating a whole liter of Ringers in that short period of time has no detrimental effects at all. It just helps to maintain perfusion of those kidneys, and we see very little kidney problems if we administer them or manage them in this way. If we're going to be transporting them, what I'll do is I'll always administer that intravenous fluid, and then I will go over to a subcutaneous fluid administration. I would give these animals, particularly if I'm anticipating transport to be longer than 4 hours or so, prior to waking these animals up in their transport crate, I will give them a liter of Ringers in addition to the 1 liter of Ringers IV. I'll give another liter of Ringers subcutaneously in the flank region, and that really supports their cardiovascular system while they're in a stressed environment inside a crate where they don't have access to water as well. So that's how I manage them. If you have a look here, you can see Dr. Caldwell just putting in that drip there, and then we'll open up that flow rate. And the intention of this video is to show you how quickly we can administer that fluid in there. And we can run it in at full rate like that without any serious negative side effects at all. All right, and then what happens if we want to keep these animals under immobilization for a longer period of time? Intravenous top-ups, I've touched on those. Medetomidine on its own at very low doses, 0.005 to 0.01 milligrams per kilogram. We can use those just as top-ups. They're relatively short-acting, and we can give repeat boluses of these. We can maintain a large carnivore, for instance, a lion, under anesthesia sufficient enough to do a full ovariohysterectomy just using medetomidine as a top-up drug, as long as our initial immobilizing combination was satisfactory. In those cases, I would use Zolitol and medetomidine initially, and then just medetomidine top-ups. But we do have other options available. Propofol on its own, very slowly to effect. One has to just be really, really careful with propofol use in these immobilized cats. They often tend to stop breathing as a result of propofol if it's administered too quickly or at too high a dose. one can have profound suppressive effects, in particular on the respiratory, but also on the cardiovascular system as well. And if we have to resort to using quite a lot of propofol, the recovery does become extended, and that potentially can be a problem as well. So we can expect a slow recovery using propofol. It generally is safe if used correctly, but there may be better alternatives. But sometimes one has to resort to using it, and if one has to use propofol as an agent for extended anesthesia, it's safe to consider it. One just has to use it very carefully. And then alfaxan is one of the newer generation drugs we have, alfaxalone. It actually has been around for a long time, but it's now manufactured and used on its own under the trade name of alfaxan. It's a 10 milligram per ml solution. And we can, just for top-up purposes or for those situations where the animal's just not sleeping deeply enough, we can use really, really low doses of alfaxan intravenously. Boluses of it, 0.1 to 0.2 milligrams per kilogram is all that's really needed. And that gives us a nice, safe extension of the anesthetic. I know in many countries in Africa it's probably not available, so that's unfortunate. But if it is, then it's something that one can consider. Very high safety margins. Those compromised animals that you may want to work on, where you can use a very low combination of your immobilizing drug to start with, and then keep them maintained with alfaxan. It's a really, really safe consideration to think about. And it's amazing the low volume that one actually needs. If you've got an initial good immobilization, a 0.1 milligram per kilogram on an adult lion amounts to 1 ml of alfaxan, and that's all that required. I mean, it seems like such a little volume that you're giving, but the quality of that anesthesia and how it extends the anesthesia is quite amazing. So we can get away with using really, really low doses and keeping good anesthesia with really safe margins. And then obviously the option of putting these animals onto gas as well, isoflurane, kept maintained at 1% with about 20 to 30 mils per kilogram per minute of oxygen flow, gives a really nice, long and safe anesthesia as well. I think, on those very long procedures, I will tend to go, for a gas anesthetic like this. One needs to have the correct equipment. Obviously, one needs to have a mobile anesthetic machine. One needs to have the right size endotracheal tubes. They're very specific, especially in a lion. Like you can see in the picture here, it's a exceptionally big actually an equine endotracheal tube that we'll use there, their larynx sits extremely deep down in the airway, and one needs that really long ET tube in order to get in there and to access the trachea, etc. But it is a very, very safe way of keeping a large cat under anesthesia for an extended period of time, especially if you've got complicated surgery, etc. I think the one caution there is that obviously they reverse very quickly from gas anesthesia. So if one has immobilized the animal with a combination of, say, for instance, medetomidine and ketamine, or medetomidine and xylitol, then the effects of those drugs after a 3 or 4 hour procedure will be minimal. And if they eliminate the isoflurane very quickly from their body after turning it off, one can get quite quick spontaneous recovery, and one has to mitigate against that. So what I do in those circumstances, as I turn off the anesthetic, the isoflurane, I then give them a top-up of intravenous medetomidine, probably at a double dose that I would normally use just for the bolus top-ups. So probably at a 0.01 milligram per kilogram, just as a bolus. And then I'm quite happy to extubate them and then put them onto a stretcher and then transport them either back to where we want to release them, or then transfer them into a recovery crate or into their night enclosure or wherever it might be. But just be cautious with the isoflurane, that you don't stop the anesthetic and without anticipating some form of fairly rapid recovery from that anesthetic. Some of the additional things that we may need to do, especially those captive cats, vitamin A is really important. Those captive cats, all of them suffer from some degree of vitamin A deficiency. So we take the opportunity to do that. Dart wound treatment is an antibiotic just instilled into the dart. We don't want to result in an abscess there. And then often what we have to do is take DNA samples. We microchip the animals. And then I think important, just from a reversal point of view, atipamezole to reverse the medetomidine. In domestic practice, we use 5 times the medetomidine dose, but in the large cats, we reduce that slightly. It can cause a degree of excitement. So 3 times the medetomidine dose for the reversal dose for atipamezole works exceptionally well. We get nice, smooth, full recovery using 3 times the dose, and we reduce those risks of some of that hyperexcitability and a peripheral neuropathy that we might sometimes see. Again, just a deep intramuscular injection for the reversal. In the big cats, don't be tempted to give atipamezole IV unless it's an emergency. For standard recovery, rather just use the intramuscular route, and they take about 10 to 15 minutes to wake up nicely. Monitoring, very briefly, pulse oximetry does work. Some of the new modalities, even using your watches, can be quite effective. And yeah, you can see a picture of using a Garmin watch, an Apple Watch, and then if you compare it to a proper pulse oximeter, you can see we're getting exactly the same results there. So don't be scared to use some of the modern technology in a very simple way. And then, of course, don't forget to use your eyes and your ears and your hands as well. TPR, so simple to do. I think a lot of the young veterinarians forget that they were gifted with hands and eyes and ears and those things, and they forget how to use them. They're your tools in the trade that are simple to use, so don't forget to use them. Okay. All right. I think that the summary, I think, really is is taken care of there. I don't think I need to go into that. I think we've discussed most of that there. And so yeah, I'm happy to. I'm going to go past that. I'm happy to answer some questions. I'm going to stop sharing here and that I can see, and you guys can see me there, and I'll come on there.
Wow, thank you so much for this very important information. Yeah, and thank you for reminding us to use our eyes, ears, and hands. That's quite important.
Yeah, especially for
Yeah.
the younger veterinarians. I find that lots of younger
Yes.
even if it's in domestic practice, when something comes in, they all want to jump to the blood tests and the X-rays and the ultrasound examinations before they've used their eyes and their hands to start with. So don't forget them. They can tell you a lot of things that those other things can't tell you.
Yes, thank you so much. All right, so for the questions, if you online audience, if you have a question, you can raise your visual hand. I can see in the chat we have a question from Upendo. She's asking, how do you handle hypothermia in the field setting?
So was that hypo or hyperthermia? Sorry, I can go into the chat. Hyper.
Yes.
Yeah, hypothermia in the field environment, the first thing that one wants to do is just to add water. So we can use chilled water. That's a very simple and easy method to apply. One has to just be a little bit careful under the circumstances you use it. Cold water works really well on them, especially if you can use some of the abdominal areas that are a little bit less sparsely covered with hair, and one can apply water there. But it does require a little bit of airflow in order to be most effective, okay? So one can artificially create that little bit of airflow, but very often the environmental conditions are such that there is some airflow, and then you can just apply that water, and that latent heat of evaporation results in quite a significant cooling effect, and we can maintain their body temperatures like that. The other alternative, obviously, is to be able to administer cooled intravenous fluids, okay, chilled fluids. It doesn't necessarily have to be really cold. I think that, fluids, and 1 liter fluid that's kept in a cool environment, when we administer that intravenously, it dissipates a lot of that internal core body temperature through the vascular system, and so we get a nice cooling effect by administering that intravenous fluids. So those are the two methods that I would do. First of all, I would start with the very basics of just superficial water application, and then if I feel that that's not going to be sufficient, then certainly I would add in an intravenous fluid line and administer some fluids intravenously, And again, that if those animals are hot, they're going to be compromised as well. And so I think that, the IV fluids is just going to be beneficial at multiple levels. Yeah.
Thank you so much. Do we have any question from the online audience? There is one from Amanda Smith, who says, did you receive any ethical approval or any permits? I don't know on what. Amanda, if you can unmute and maybe add some more information to your question.
Good afternoon. Thank you. Yes, in South Africa, you have to apply for ethical for any animal studies, as well as according to SANS permits. In Africa, did you receive anything or apply for anything, or is it not necessary? Thank you.
Yeah, look, I can't answer, that question for every African country. You're quite right when you say that in South Africa, it's very closely regulated. So some of the, the species, we have a threatened and protected species list, and any animal that is immobilized or worked on that falls part or is on that threatened or protected species list needs a permit applied for in order to do any form of immobilization. So yes, certainly that needs to be considered in South Africa. If we then want to transport that animal, then we also need a transportation permit that is applied through through our nature conservation authorities. So those are in South Africa, certainly the things that we need to adhere to. If our immobilization forms part of any form of research protocol or any research project, then there has to be an animal ethics clearance as well for those things. So we can't just go ahead and just do research as we feel fit. It needs to be done through an academic institution, and it needs to be passed and regulated by their animal ethics committee. But from a perspective of just commercial, our normal, veterinary work, it is fairly strictly regulated in South Africa through the permitting system. But if they don't form part of our threatened or protected species, as veterinarians, we want to immobilize them from a health perspective, then we don't need to apply for permits every single time. But certainly if we're going to look at transporting them and relocating them into new environments, then a proper permit needs to be applied for in order to do that. Elsewhere in Africa, I think the regulations are probably not quite as strict and stringent, but there would certainly be certain conditions that will apply in certain countries. And I think that's an important point from a veterinary perspective, that it's our responsibility to ensure that we abide by those regulations, and if it's necessary for us to apply for permits, that we need to apply for them. And we mustn't leave those decisions up to other authorities. Us as the people responsible for the immobilization need to make sure those permits are in place if necessary.
Thank you so much, Amanda, for the question, and thank you, Dr. Brendan, for the answer. I see we don't have any more questions. I would just ask Bridget if there is anything from their side before we end the session.
Hello, everyone. My name is Bridget Mnyalila. I am a wildlife veterinarian at Lilongwe Wildlife Trust, and I am also the wildlife medicine lecturer here at Lilongwe University of Agriculture and Natural Resources. I just wanted to say thank you to all the speakers who joined us today, Dr. King, Kate, Dr. Brendan, Dr. Mukami. It's amazing, Dr. Brendan, that you worked in Malawi reintroducing animals in Majete. So Majete Wildlife Reserve is one of the most beautiful and magnificent parks here in Malawi. And to know that you were part of the history of Majete Wildlife reintroduction, wow. We are truly inspired. I truly appreciate you all for taking the time to share your expertise with us. Now they don't have knowledge specific to only Malawi wildlife veterinary practice, but also to other countries' experiences as well, and I'm thankful for that. And also, thank you, Share Screen Africa. The series have been amazing, from having different great speakers for all the different species and to all the live demonstrations. It has been a great, great addition to the wildlife medicine curriculum here at Lilongwe University of Agriculture and Natural Resources. I wish we had more sessions on other species as well, like primates and pangolins. I'm sure in the future. But yeah, thank you so much for organizing this. Thank you, all the speakers. We are truly grateful for the knowledge and we will cherish this forever. Thank you.
Thank you so much, Dr. Bridget. We would also like to thank our students for being so active, asking questions. And let me promise, if there are some questions that have not been answered in the chats, we'll send them to the speakers. And when we get answers, we send them through to them. Thank you so much. And to our speakers, thank you so much for your time. We understand being a wildlife vet, it means like being so busy. So yeah, thank you for making time to share your knowledge with the students, and you've made a difference, not only for Malawi, but for Africa at large. So I will just share my screen again so that we should remind each other on the learning outcomes. All right, so from this session, I hope you are able to understand why wild carnivores like lions, cheetahs are captured. Secondly, you are able to explain effective capture and immobilization techniques for large carnivores. And thirdly, you are able to explain the drug protocols and how to monitor animals during anesthesia. Fourth, you are able to identify and manage and explain how to manage common diseases in wild and also captive carnivores. Lastly, you are able to explain the post-capture care and innovations in wildlife veterinary medicine. Thank you so much. Have a good day.